Welcome to Chapter 7, which is going to cover the ventilation, perfusion, and shock. All of this to develop an understanding of pathophysiology. So pathophysiology is essentially just the study of how diseases affect the function of the body. Knowing pathophysiology is very important to understanding those gray areas of what's going on with your patient. So to have a good knowledge of pathophysiology means that you know why you are treating your patient and what is the right thing to do. It's not that, well, they have this symptom, so I'm just supposed to give them this. You need to know why they are presenting like this and why, when you give them that medicine, is it going to help them, or could a different medicine make them worse? It's very essential knowing this, the pathophys of the human body. So the very smallest part of the human body is the cell. So at the cellular level is really where everything is happening. As stuff's happening at the cellular level, if it starts to get worse, where you're starting to see the outward signs of it, then it's going from cellular level to more systemic levels. So everything starts happening first at the cellular level. So within that cell, we won't dive too much into that, but in the cell it does have that membrane that protects it. So it's just kind of like that big protective wall that prevents stuff from getting in, stuff from getting out, stuff that's supposed to get in, it lets it get in, just kind of like the gate guard. Okay, so the mitochondria within that cell, one of its most essential jobs is to convert glucose, the sugar that's within your body, and some other nutrients into adenosine triphosphate, ATP. You will hear the word ATP a lot within this class. ATP is essentially the fuel for your body. This is the fuel that just makes everything happen, everything function the way it should within the body. Without ATP, your body's not going to function very well at all. So your body is just like planet Earth. It is mostly water. 70% of the water is an intracellular fluid. So within that cellular level is where most of that fluid is. 5% of the total body's water is within the vascular fluid, and 25% of total body water interstitial fluid, so within our tissues. As a large part of the body is water, those cells need to have also a fine balance of water in there. So the cells and the whole body, they're just kind of like Goldilocks. Stuff can be too much, too little. Everything needs to be in a nice harmonious balance. So the cells are the same way. So they need that correct balance of water on the inside and the outside. Different changes in levels of the water can also change the body's pH level, also affecting the permeability of that cellular membrane, of how well that gate guard acts. So you get that gate guard a little bit drunk, getting too much fluid in there, they're going to start letting stuff come through the gate that they probably shouldn't be. So with those cells, you can have too little water or too much water. So affecting all those levels of electrolytes, ultimately affecting the pH of your body. So those of you who have a pool or know a friend who has a pool, which I always recommend to have the friend that has a pool, because then they're the ones that are out there testing the water, measuring the pH levels, and you just get to reap the benefits from having a neighbor with a pool. So in this little dynamic here, you got aerobic metabolism. So you see here, you got the cell, the membrane, and you've got glucose and oxygen coming in, creating that Krebs cycle, and a lot of energy production happening. Whereas an anaerobic metabolism, you don't have any oxygen coming in, it's only glucose getting into that cell. So with that, there's just a small amount of energy that's being produced, and the major byproduct of that is lactic acid. So if you've ever been around the fitness world or anything, I'm sure you've heard of the term of lactic acid. So there are a lot of diseases just in the same manner that having too much or not enough water in there can affect the permeability of those membranes. So do other chronic illnesses. I mean, if you have people who have cancers, leukemia, just other chronic systemic illnesses and stuff, it's going to affect the cellular level. So, those people are really easy to have systemic failure, organs failing, and stuff like that, just because at the cellular level, everything isn't as good as it should be. So now we'll move on to the cardiopulmonary system. So the cardiopulmonary system is essentially the system of your heart, cardio, and pulmonary, your lungs. So with those, they bring the oxygen in with the pulmonary side and distribute it through the cells through gas exchange and whatnot. And the cardio job is to be circulating all the oxygen that's come into the body, all the other blood cells, everything, and then it's helping circulate out that waste. So like when that Krebs cycle, when that byproduct of CO2, circulatory system will circulate that CO2 out into the lungs where you're going to exhale it. So within the airway, this picture here is all the lower airway. So you see here your trachea, that's the midline of your neck. Okay, then as it comes down here into your trach, okay, this is like when patients get intubated and whatnot, the tube is going down into here. So all this is a pathway for air throughout this area right here. In this area there's no gas exchange, this is just the tunnel getting into the next areas. So then you have your left main stem bronchi and your right bronchi. So as it comes down to the trachea, it gets out here into these bronchioles. The bronchioles are the very smallest part of that. So if you can kind of imagine this as being the tree roots and then all the little smaller roots branching out. So as oxygen comes out in here, it goes into this bronchiole. So here you see the kind of a graphic image of the alveoli and how gas exchange happens. So over here you see your alveoli and those capillaries that are wrapped around each one of them. So over here is your capillary. Well, then within that you've got your oxygen coming down in and you've got the CO2 coming out. So as the body circulates, you have your within your bloodstream, you have carbon dioxide coming back to the lungs. So as oxygen has come into the body, so oxygen's coming in, it circulates throughout the body. So then it goes on out here, goes out to all the other cells. Well, then coming back into this end is CO2. So as it's come out through, as oxygen goes through, it goes to the cellular level, Krebs cycle happens, it utilizes all that oxygen, and then that CO2 gets distributed back into the bloodstream at the cellular level, coming back in through here. So then as oxygen meets down in here again with the CO2, they just essentially change places. So you can kind of think of this at the alveoli as this is more of a boat dock. So that red blood cell where the oxygen adheres to, so your red blood cells down here is where all your oxygen hooks onto, that's your boat. So oxygen comes in, waiting in line, CO2's on that boat. As the CO2 offloads, that O2 onloads onto the boat and then circulates through, and then the process just continues. Lungs, as you saw the little graphics earlier of the bronchioles, the bronchi, all that stuff. So the lungs are the lower airway. So that's where all the gas exchange and everything is happening. So a little bit of math equations here, but don't get freaked out just yet. This isn't that you're going to have to be calculating math in the field with these patients. It's just a good mathematic understanding. So the tidal volume of your respirations is how much air you bring in and out during one breath. So that's essentially how much air you can suck in from outside. That movement of air in and out is your tidal volume. The minute volume is you take your respiratory rate and multiply that by your tidal volume to understand how much air you're essentially moving in and out in 1 minute. Okay, and again, the body likes homeostasis, just like Goldilocks. The body wants that good minute volume because a set minute volume by our natural design is what the body needs for everything to function properly. And no matter what Bobby Boucher's mama says, the medulla oblongata controls stuff in the brain. It's not the rays of sunshine, or it's not because the crocodile's got all of them teeth and no toothbrush. In which I hope all of you listening understand what the water boy is, or this whole example kind of goes out the window. Anyways, so the medulla oblongata is in the brain stem. This controls your respiratory pattern. So any change to that could affect the medulla oblongata can affect that minute volume. Such things being as trauma. Major head trauma patients can impact and affect that medulla oblongata, throwing a respiratory pattern into a tizzy. Drugs, toxins, all those, when you get drunk and it makes you really sleepy, that's a depressant. So it will affect your respiratory drive. Drugs, heroin being the big one nowadays. People shoot up heroin, so the medulla oblongata goes to sleep, forgets what to do, and the patient quits breathing. Any disruption of pressure, whether your chest cavity can't expand to be getting that air in due to trauma, jilling, stuff like that's kind of tied into trauma. If you're having any disruption of pressures or anything that's accumulated in that space, which is generally secondary to trauma. Some medical diseases will make fluid build up in the lungs, which is definitely going to decrease that tidal volume and affect your gas exchange. So as we talked about the body's ability to compensate by lower tidal volume, respiratory rates go up. There's also things that can affect not just with that, but there's what's called a chemoreceptor, and that's within the bloodstream. So the body's detecting those chemical receptors are measuring how much oxygen and how much carbon dioxide are in the bloodstream. So the chemoreceptor is going to send a signal back to the brain, tell them, hey, we need to increase the rate or the tidal volume depending on what's going on. So if a patient's oxygen levels are going down, the body's going to be like, okay, something's not right, let's try to get some more oxygen in. So they're going to try to take deeper breaths, more of them want to get more oxygen in. Or if it senses that there's high levels of CO2, it's going to also tell, okay, we got a bunch of CO2, we got to breathe faster to get rid of all of this. And as we get more into the medical processes, we'll dive deeper into this concept. So with blood vessels, that's what's circulating the blood through your body. You essentially have two types of vessels, an artery and a vein. So in these images, you're going to generally see arteries as being red and your veins are going to be blue. They're not really that color in the body. If I was to hack the end of my arm off right now and you could see my arteries and my veins, they're all going to look the same. Okay, your arteries, if you look here kind of in the pictures, they got a big thick wall on them. They're very muscular, very thick. And the veins, they're a little bit smaller. So the arteries is what's carrying the high pressure blood. The arteries, A for artery, means that it's taking the blood away from the heart. So as the heart squeezes to pump the blood throughout the rest of the body, it starts out through the arteries. Okay, so these arteries are what can control the vascular tone and whatnot. So if we're starting to lose a little bit of blood, these vessels get a little bit smaller. We'll cover that just a little bit later. So arteries, once they start to branch out, they are then be called arterioles. So as they get even smaller, they come out here and they go into the capillary beds. Now remember talking about alveoli. The alveoli are surrounded by capillaries. That capillary is the smallest part of that blood vessel where all the gas exchange, nutrients, everything's happening at that cellular level. So once it's went from the arteries to arterial and it goes over the capillaries doing its job, its gas exchange, then it starts into the vein side of the vascular system. So from the capillaries, it goes into the venules. From the venules, it goes up into the vein. Now notice here in the picture of this vein, you got these little valves. So that's designed that blood is only supposed to go this way, just in through one way. So that acts like just as a valve and a gate, so that blood doesn't somehow come back out the wrong way. So those arteries that go away are carrying oxygenated blood from the lungs to those capillary beds. And the gas exchange happens, the oxygen's in those capillaries, swapping out, it's used all that it can, CO2 is leaving the capillary beds, getting into the vein side, which returns back to the heart for gas exchange to happen there. Now, with all that to make circulation happen, you gotta have good adequate pressure. So if your patient's got low blood pressure, it's not going to be enough to circulate that stuff around as well as it should. So just imagine if you're in a kayak, and that kayak is an analogy for that blood vessel, and you want to go really fast down the stream. Well, you got to have a pretty good stream of water behind you to make you circulate back through. If you just go and hop in a shallow stream of water that's not moving real much, you're not going to move very fast either to get to everything you need to get back to your vehicle to eat lunch and everything else. Also, the pressure that's controlled by the size of those blood vessels, as well as in the pulmonary side where there's receptors to identify if you need to speed up your ventilations and whatnot to control your gas exchange and all that stuff. You know, if you don't have enough oxygen, those chemoreceptors sense that, make you change up your tidal volume, respiratory rate, all that good jazz. Also in the blood vessels, there are baroreceptors. Those baroreceptors measure the pressure. So thinking about baro, the barometers, if you've ever watched the Weather Channel, they're talking about the barometric pressure. So it's talking about pressure within those vessels. So within those vessels, if those receptors sense that, hey, there's not enough pressure being exerted on those arteries, where I talked about how they got those big muscular walls, that vessel size can change depending on what those receptors are picking up. So as you see here, a normal blood vessel is completely full of fluid. Okay. Then down here you have your dilated vessel that is only about, I'm pretty optimistic, some say half full of blood, not so much half empty. Okay, so you imagine you're out here and you go to the ice cream shop, or you're going to Dairy Queen or whatever your local favorite ice cream shop is, and you got this awesome milkshake, and you got this great big old fat straw, and you're going to town sucking on that milkshake. So you're getting a good flow of milkshake in your mouth until you get to the bottom. So up here, you got a good milkshake. You got a straw completely full of that delicious ice cream. Then over here, you're kind of at the bottom now, so you're running out of fluid. That straw, being your blood vessel, doesn't have enough to keep that up, to keep circulation going. So then what happens when you're running on ice cream? You start getting that slurping sound happening because your straw is not full. You're having to suck and work harder to try to get that milkshake up. Now, capillaries within that bloodstream, apologize, chair's a little squeaky. But those capillaries can have permeability issues, meaning that the fluid, knowing that the plasma, everything that's in our blood, within those capillaries, they can become damaged from infection, other underlying diseases, so they'll lose fluid out through their walls. So if you've ever seen anybody who's say has heart failure, liver failure, and that stuff, you may see they have these big swollen feet or hands and stuff. And that's what that is those underlying health issues has caused that fluid to leak out of the walls of that capillary bed. So you got fluid going to places it shouldn't be. That fluid's supposed to be in the circulatory system, but it has leaked out. Capillary bed has sprung a leak. As you see here, one of the biggest issues that has caused this is chronic hypertension. Hypertension meaning high blood pressure. So for years and years and years, this blood has been in this vessel, just pushing against the side of these walls, causing them to start getting little cracks here and there. Over time, these vessels had all they can, are starting to get dry rotted, and that fluid was supposed to be in here is going to now leak out. So this could be down into your feet or out in your hand, fluid going to where it shouldn't be, or even out into your lungs. So as I was saying about hypertension causing all that pressure inside those vessels to start making those capillary beds lose their permeability. They're starting to lose their fluid and everything. This is also a major risk factor for stroke and heart disease. So you can imagine if the vessels are starting to crack, fluid, blood can get into other places it shouldn't. So the blood that's in those vessels can pop and spring a leak and go out just as well as that fluid can. Within that heart, every time that heart squeezes, it ejects about 70 milliliters of blood per contraction. That is what's called your stroke volume. So every time a heart squeezes, the amount of blood that comes out of there is called the stroke volume. So just good Jeopardy stuff. It's about 70 milliliters for each contraction. Not really a whole lot. Also, with cardiac output, some more math. So don't freak out yet. You don't got to get your calculators out just yet. So that cardiac output is your heart rate times that stroke volume. Just like where your minute volume was your respiratory rate times your tidal volume, that cardiac output. There again, the body in homeostasis has a certain desired amount of cardiac output that it needs to make everything in the body really happy. So if the stroke volume starts to go down from whatever reason, say if the patient has lost a lot of blood, if there's not as much blood in the body as there normally was, each time a heart contracts, there's a little less blood to work with. So what do you think happens when the body loses its stroke volume? It's losing blood, or the body's losing its ability to contract. So each time there's not as much blood coming out of the heart. Take a second, think about it. Yes, the heart rate goes up to maintain that cardiac output if that stroke volume goes down. Also, kind of on the reverse side, if something were to happen, it causes that heart rate to go up, the stroke volume is also going to be affected. So we can kind of reverse that equation, throw it in an algebraic equation, but we're not going to go that far. But just know if that heart rate goes up, thinking about that preload and afterload, that stroke volume is going to go down because the heart's squeezing so fast, it's not having enough time to fill up all those chambers again to get all that blood back out. So there's inadequate time for that heart to refill each time that heart contracts. So somebody whose heart rate just went really high, like if you've ever just worked out way too hard, you're trying to push it, getting on that treadmill and your heart rate's going higher, and all of a sudden you're starting to feel a little funny, your stroke volume is not able to keep up and your cardiac output is going down. So now let's kind of put all those two concepts together of the cardio system and the pulmonary system. All that works together. One of the biggest components of keeping you alive is your heart and your lungs. There's A, B's, and C's, your airway, your breathing, your circulation. There has to be a good balance between those two, or you're going to have what's known as a VQ mismatch. So if you've got good ventilation, being V, you're getting air in and out, but your blood flow sucks, being perfusion. Perfusion is that ability to get blood to the areas it needs to get to. You're going to have a VQ mismatch, not keeping everything around. Whereas if you got good perfusion, your heart's squeezing away, but you just don't have a good airway, it's just kind of like a teeter-totter. So if you get one end a little bit lighter than the other, stuff starts to go off kilt and just causes a breakdown in whole systemic operations. So when that stuff kind of starts to happen, is known as shock. Shock is essentially the body hypoperfusing. The body's not circulating blood as well as it should, caused by multiple types of disorders. So no perfusion, circulating of that oxygen and all its nutrients and removal of that waste, removing the CO2, all those bad byproducts of the Krebs cycle, getting all that stuff back out of the body is not the ability, the inability to make perfusion happen appropriately is shock. Hypoperfusion is shock. So ways to recognize the compensation of shock. Pretty simple stuff. First, you're going to be having these increased respiratory rates and increased heart rates, trying to make up for that tidal volume and your VQ mismatch, trying to maintain that cardiac output. You're going to have slight mental status changes once that minute volume's decreasing, not leveling out as it should, not getting enough oxygen in, that cardiac output's being affected too, your brain's not getting enough oxygen and blood as it should, and then pale, cool, clammy skin. Your skin's getting pale, because think about it, our skin's generally nice and pink because blood is red, causing that pink color. It's nice and warm. We're warm because the Krebs cycle, the chemical reaction produces heat. That's why our bodies are warm. And that clamminess. Also, diaphoretic. If a patient is diaphoretic, they are fixing to die really quick. And what diaphoresis is the patient will be sweating profusely. Some of these patients, it might look you just pulled them out of a pool. They're sweating so bad from shock. So now we covered the meat and tater systems. We'll talk about the pathophys of some of the other body systems. The nervous system, a big component. So damages to the nervous system can cause that random vasodilation, causing those vessels to lose their vascular tone, causing that distributive shock issue, causing that container issue where the vessels just randomly dilate from no neurological signals telling those vessels what size to be. So those baroreceptors that are the pressure receptors, they're losing their signals, so they will dilate because they don't know what size the vessels are supposed to be. So the nervous system being your spinal cord and your brain. So any damage of those, you can imagine, could really screw up a lot of stuff. Generally, trauma is what is causing all of that. Your endocrine system, its job is hormone imbalance. Okay, so now I know what you're starting to think. Oh, hormones. yeah, trust me. I've been married for a while. I understand hormones pretty good, but it's not kind of in that same analogy. So with endocrine system, those organs can affect multiple things. So the major organs of the endocrine system being your brain, your kidneys, your pancreas, and then your glands, your pituitary gland, your thyroid gland, and adrenal glands. So if you've thyroid disorders are fairly common, so you may know somebody who has a thyroid disorder, and they can have issues with like weight problems, where a lot of endocrine system people, that's one of their biggest issues is weight control, whether they can never put on any weight or they can't ever take off any weight, where they're stick thin or they're really big. So different diseases causing to have too many hormones or not enough. So again, the body is fine balance. If too many hormones are being produced and those hormones are out there causing other chemical reactions happen in the body, trying to control systems functions within the body. So they can cause a variety of symptoms. They can make patients' heart rates just go really high for no apparent reason or slow down. It can make a patient be extremely hot or extremely cold. Just kind of all regulatory systems in the body, those hormones, when they go off, just kind of throws everything off kilt.